Assalamu alaikum. My name is Sana Baba, and today I, along with my group members, am going to present on the topic of malignant carcinoma. So, the major topics that we are going to discuss today's presentation include the definition of malignant carcinoma, its different types, hallmarks, stages, pathology, TNF staging, and its classification. So, let's deep dive into the presentation. Beginning with the definition, malignant carcinoma is a cancerous tumor arising from the epithelial cells characterized by uncontrolled growth, local tissue invasion, and the ability to metastasize to distant organs. In layman language, it is a subcategory of cancer but different from the ordinary cancer for originating from epithelial tissues only. Historically, its concept dates back into ancient times, such as Hippocrates, who first used the term carcinomas. This historical understanding laid the foundation for modern oncology. So let's learn more in depth about our topic.
Cancer is not a single disease. It occurs when body loses control over growth and division, lead to the formation of abnormal cells. About behavior, the cell behavior changes significantly. First, they lose control over multiplication and fail to go apoptosis, which is the natural killing process of damaging cell. In cancer, cells reproduce much faster than normal cells. There are two types of tumor, benign and malignant. Benign tumors are slow growing, encapsulated, and non invasive, while malignant tumors are fast growing, non encapsulated, and invasive. So they invade in nearby tissues. Benign tumor end with suffix "oma", while malignant tumor end with suffix "carcinoma", which is the most dangerous type of the tumor. About types of cancer, there are many types. First, carcinoma. Carcinoma are malignant tumor originating from epithelial tissues. This is the most common type of cancer. Sarcoma arise from connective tissues, lymphoma are cancer of lymphatic system, and leukemia are cancer of blood forming cells. Now, and you see the picture in which many sites of cancers are represented. As I tell you about carcinoma, sarcoma, lymphoma, and leukemia, where they are present.
बस ऐसे ही करती रह देख
Of cancers, okay. Here are etiologies. There is the main what is the main cause of the cancer and molecular basis and change in genes and DNA. Yeah, okay. Then the etiology, then major causes are
चल
genetic
थोड़ा सा
factors, then genetic factors, activation of oncogenes, and within oncogenes and activation of tumor suppressor genes, defects in DNA repair genes. Okay. उसके बाद environmental factors,
दोनों हाथों से
carcinogens, and then physical agents and biological agents. Okay, and then now here are oncogenes. What are that are the major cause of the cancer. Okay, oncogenes when they are mutated, they causes cancer. Mutated overexpressed proto-oncogenes. Normal genes that cause the normal growth of the cell and are proto-oncogenes. When they are mutated, they become oncogenes. Promote uncontrolled cell division. When they are activated, they cause uncontrolled division of cell. Okay, next examples of oncogenes are RS, MR, MYC, HER2. Okay. Next, markers tumor suppressor genes. Tumor suppressor genes are normally inhibit cell proliferation. It controls the growth of the cell. When the body does not require cell, they inhibit their growth. But when they are mutated, they do not perform their work properly, and they lead to cancer. Examples of tumor suppressor genes are P53 and gene AP6. Okay. Next, DNA repair genes. DNA repair genes are failure leads to mutation and accumulation of genes. Okay, in the examples include BRCA1 and BRCA2. So, next we have the pathology of prostate cancer. Prostate cancer is most commonly an adenocarcinoma arising from the peripheral zone of the prostate. Pathologically, it shows small, crowded glands, loss of basal cells, and prominent nuclei. It is graded by the Gleason scoring system. The tumor commonly spreads to the bones, producing osteoblastic metastasis.
As cancer has been previously discussed, now I am going to tell you about the four stages of cancer. The first stage is the cell with the genetic mutation, and the next stage is about the microscopic cancerous cells, and the next stage is about the large enough to be a lump and then surrounding in your blood, and the stage D is separate from distant places of your body. Now, what is the basic? Obviously, we are going to talk about basic pathology, and first is it is classified into two stages: the molecular stages and the cellular stages. The cellular stages in the cells, it initiates the responses, then it promotes, it rapidly proliferates, and then you have the progression that actually it does not reside in your body at a localized position. It actually rotates or circulates in your body. And the last one is metastasis, it means the overgrowth, the overproduction. The next one is actually about the microscopic stages, that is actually the histopathology. What does happen in the cell? Decided because hyperplasia, increase in the number of cells, dysplasia, disorganized cell growth, and the atplasia and the anaplasia, that is actually the complete loss of the adult cell characteristic. Now, going to tell you about the hallmarks of the cancer that are actually the sign also the cancer. About the cancer. About the sustained proliferating fingernails. Next one is evading growth suppressors. Next is resisting cell death. Inducing angiogenesis, that is the formation of and the activating invasion, and the cell is and the deregulation, cellular energetics, avoiding immune disruption. These are actually the hallmarks of the cancer that contribute in the signaling of cancer state.
Now, I'm going to highlight the warning signs of cancer, in which one has change in bowel or bladder habits, then a sore throat, unusual bleeding, lump in breast, and indigestion or difficulty in swallowing. The sixth one is obvious change in wart or mole, and the last one is nagging cough or hoarseness. Now, there are different types of pathological cancers, in which one is lung cancer, the second one is breast cancer, the third one is prostate cancer, and the fourth one is colorectal cancer. Lung cancer is a leading cause of deaths worldwide. It is divided into two major pathological groups. The first one is non-small cell lung cancer that includes adenocarcinoma and squamous cell carcinoma. And the second one is small cell lung cancer. NSCLC accounts in 85 to 95% cases. Adenocarcinoma arises from the mucus secreting cells and it is most common type in the non-smokers. And the squamous cell carcinoma and the small cell lung cancer, they both occur in the smokers. And the small cell lung cancer is a very highly aggressive and it's a colorectal cancer pathology. It starts in the lining of the colon or the rectum, and the adenocarcinoma occurs in most 96 cases. Polyps to the cancer start as a benign growth called the adenomas and then slowly transform into the malignant tumors. If we talk about variants, it's very rare pathological forms, including the signet ring that is very aggressive and the mucinous carcinoma.